All right, so a very good evening to all of you. A very good evening to all of you. So, how is audio visual? How is audio visual? Now we are starting with all the previous year questions related to subject PSM. Now my first question is, which of the following is a non-parametric test? Which of the following is a non-parametric test? Non-parametric test. So here I want to tell you that of significance. In the test of significance we have parametric and non-parametric. Parametric and non-parametric. In parametric, if I have one group, it is pair t-test. If I have two group, it is unpaired t-test. And if I have more than two group, it is ANOVA. It is ANOVA, right? So pair t-test ruled out because it is a parametric test. ANOVA, I already told you it is a parametric test, so it is also ruled out. Now I have two options, option A and option B. So option A is correct answer here. Mann-Whitney-Hughes test is a non-parametric test. Mann-Whitney-Hughes test is a non-parametric test. So this is used when data is non-normal. What do we mean by normal data? Yes, what do we mean by normal data? When we don't have any outliers. Or you can say when median is given. When median is given, Mann-Whitney-Hughes test is used. Now coming to second question. Which of the following government scheme program were introduced only to reinforce primary health care of child or newborn? Okay, so first is Rashtriya Kishore Swasthya Karyakram. Let me tell you, this program is for adolescent. This program is for adolescent. Janani Suraksha Yojana. In this program, we give cash incentive to pregnant mother and ASHA for institutional delivery. Institutional delivery. Okay, what about Janani Shishu Suraksha Karyakram? In this we give free diet, free transport, free medicine, free surgery to a pregnant woman. So this is also not related. Then the answer here is Rashtriya Bal Swasthya Karyakram. In this Rashtriya Bal Swasthya Karyakram, we are screening. We are screening 0 to 18 year. We are screening 0 to 18-year-old child, or you can say adolescent, for 4 Ds. What are those 4 D? Number 1 is any disease, any deficiency like iron deficiency, vitamin deficiency, any developmental delay. Any developmental delay or childhood diseases, right? So here the correct answer is Rashtriya Bal Swasthya Karyakram. Now next question is chi-square test can be used for. So I was telling you there are two tests, parametric and non-parametric. This parametric is used when we have mean, and non-parametric is used when we have percentages. I can say this is used for quantitative data and this is used for qualitative data, right? Okay, so if I have one group, or two group, or more than two group, in this case I'm going to use McNemar, and in this case I am going to use chi-square, right? In this case I am going to use chi-square. Now, okay, age in number, it is a quantitative data, not used. Height of children, quantitative data, chi-square not used. Size of tumor, quantitative data. So correct answer here is grading of cancer. Correct answer here is grading of cancer. Okay, a chronic smoker comes to you. What are the 5D of advice to quit? 5Ds are delay, right? So you have one smoker and that smoker is asking you, doctor, how I can quit the smoking. So you will say, whenever you feel urge to smoke, number one step is delay that urge, right? So if you are feeling the urge right now, you ask yourself, delay. Okay, I won't have the cigarette now, I will have it after like 1 hour or 2 hours. So delay. Second is to distract yourself. Third is to drink water. Take a deep breath and then you can discuss. So correct answer here is A. Delay, distract, drink water, deep breathing and discuss. Now, according to evidence-based diagram, arrange the following in increasing order of evidence. So what are the options we have here? Case series, okay, cohort, RCT, systematic review. So best is systematic review among the given options. Then we have RCT, then cohort, and then I can say case series. So in the given option, answer A is correct. In the given option, answer A is correct. Clinical trial design in which each patient receives both. All right. So we are doing RCT, and this is my group A, this is my group B. So I gave a old drug to group A and new drug to group B. After 1 year, I just checked the result, how it went, how my new drug responded. Till this point, if I am doing the study, it becomes my parallel RCT. If now after 1 year, what I am doing is I am doing a crossover. Earlier to the group A, I was giving old drug. Now I will be giving new drug to group A. And now I'll be giving old drug to group B. Right? This, if I'm doing this, right? So up till this point, parallel. If I'm doing till this point, it becomes my crossover. So all the two groups, they receive both the drugs, right? So here the correct answer is D, crossover design. Now, which is a disadvantage of case control study? Right? Okay. Does not measure incidence and it yields only relative risk. No. So relative risk and incidence is measured in cohort study, whereas in case control study I get odds ratio. So this is not wrong. Ethical violation, if I am taking due permission from my ethical committee and I have followed all the guidelines, there are no chances of ethical violation. Need huge population? Not necessary, right? Attrition of population. So here the correct answer is does not measure incidence and yields only relative risk. Which of the following compares the risk of an event among one group with risk among another group? So risk ratio, or you can say relative risk. Can you tell me what is the formula? Yes, can you write in the chat box? Yes, can you write in the chat box? And yields only. No. Incidence among exposed divided by incidence among non-exposed. Right? So here the correct answer is risk ratio. Okay, statistical test to be done where more than two groups of non-normal data. Okay, so if you have non-normal data, it means median is given. And now if you have two group or more than two group, if you have two group, then you use Mann-Whitney U-test. If you have more than two group, we use, yes everyone, Kruskal-Wallis. We discussed this in class. Yes, we discussed this in class. Okay. All the following are characteristic about this bell-shaped curve. This bell-shaped curve is a standard normal curve. This is a standard normal curve. Now see what are the options given. Exhibit zero skewness. Yes. In a standard normal curve, we don't see any skewness. Up to 3 standard deviation, that is also true. It ranges from -3 to +3. Mean is greater than median. Now this is the correct answer, because in standard normal curve, mean is equal to median is equal to mode. Mean is equal to median is equal to mode. Right? Now, coming to next question. Coming to next question. So am I audible? Yes, everyone. Yes, everyone. Am I audible? Yes, everyone. Am I audible? Okay, so there was some network issue. All right. So mean is 10. Variance is 4. What is coefficient of variation? So coefficient of variation is standard deviation divided by mean multiplied by 100. But now they don't have given standard deviation, but they have given variance. So let me tell you, standard deviation is equal to under root of variance. So if variance is 4, standard deviation is 2. Okay, so 2 divided by 10 multiplied by 100. Correct answer is 20%. Right? Correct answer is 20%. Now, which of the following is not affected by outlier? Okay, not affected by outlier. Mean, yes, it is affected by outlier. The range is also affected by outlier. Interquartile range is not affected. Right? So what is affected? Okay, what all is not affected? Median is not affected, mode is not affected, and interquartile range is not affected. Okay, now what is affected? Mean is affected, standard deviation is affected, range is affected, right? So here the correct answer is interquartile range. Grading of carcinoma is, okay, so grading of carcinoma is ordinal scale. Grading of carcinoma is ordinal scale. Whenever we have any kind of category or any kind of order, it becomes ordinal scale. Can you give another example? Okay, mild, moderate, severe is also example of ordinal. Okay, so here correct answer is ordinal. Alright, sensitivity of a test is described by, let me tell you what is sensitivity. Among all diseased, how many are positive? This is sensitivity. Among all disease free, how many are negative? This is specificity. Now, so healthy population with positive test divided by total diseased population. No, this is not sensitivity. Healthy population with negative test divided by total diseased population. No. Diseased population with negative test. No. So here the correct answer is disease population with positive test by total diseased population. Which of the following is the best evidence study design for orthodontic cases? For any case, the best evidence is always meta-analysis, and then after meta-analysis I have systematic review, and after systematic review I have RCT, then I have cohort, then I have cross-sectional. Okay, before cross-sectional I have also one study, that is case control, right? And ecological, and right now, so this one is the best and this is worst, right? So here the correct answer is meta-analysis. Okay, so p-value. P-value less than 0.05 is significant. It is significant, right? Null hypothesis is rejected when we have p-value less than 0.05. Right? Null hypothesis rejected when we have p-value less than 0.05. A value that describes a characteristic of an entire population. This is known as population parameter, right? So population parameter is a characteristic of entire population. Okay. 99.7% of observation will fall within. Okay, so I am drawing again standard normal curve, and the middle line here, it corresponds to mean, and this one standard deviation, range of one standard deviation is 68.3%. So one standard deviation follows 68.3%. Then I have two standard deviation. Two standard deviation follows 95.4%. Two standard deviation 95.4%. And it is the three standard deviation which covers 99.7%. 99.7%. What they have asked? 99.7. So C is the correct answer. So the following study is indicated to find incidence. Yes, incidence of caries. Incidence we get from cohort study, right? and cohort study is a prospective study. So what do we get from a case control study? So case control study is a retrospective study, and it gives me odds ratio. It gives me odds ratio. Okay, what about this cross-sectional study? This gives me prevalence. All right, to summarize, we get prevalence from cross-sectional study, we get incidence from cohort study, we get odds ratio from case control study. Now, if I ask you more, where you get risk ratio or relative risk, attributable risk, population attributable risk, again from cohort study. We get all these strength of association from cohort study. Simplest measure of variation for a quantitative data. Okay, so ME is most commonly used. This is the most commonly used, right? Okay, I'm sorry. Here they are asking measure of variation. So in measure of variation, this is range. Range is simplest, but standard deviation is most commonly used, right? Standard deviation we use most commonly, but range is the simplest one. Purpose of a randomized clinical trial. So what we are doing in randomized clinical trial, right? So what is randomization? Let me tell you what is randomization. Okay, so we are doing a study to find effect of a new treatment. I have 100 patients and 50 I want to give old drug and 50 I want to give new drug, right? 50 old and 50 new drug. Now, among these 50, whom to give old and whom to give new, what we do is we make a chit of these 100 patients and we select them randomly. Okay, so this you go A. Like we don't know which patient is going in which category. We don't know, right? This is randomization. Obviously, it is done to eliminate selection bias. It is done to eliminate selection bias. Case control study yields we have just discussed. I am not going to tell you the answer here. You are going to tell me in the chat box. Yes, case control study yields what? Odds ratio. So odds ratio, I am repeating, case control, incidence, cohort, prevalence, cross-sectional, and attributable risk cohort. Okay. Which of the following is used to show geographic distribution? Geographic distribution we get from spot map, and line diagram gives me time distribution. It gives me time distribution. Line diagram gives me time distribution. Okay, selection bias is, okay, now they have given definition of some biases and they are asking which is selection bias. The bias arises because of different rate of admission of hospital. This is Bergsonian bias. Bias occurring when interviewer knows the hypothesis and also who cases are. This is interviewer's bias. When cases may have a different recall, this is recall bias. And the cases and control may not be representative of cases. This is, right? So this is my selection bias. A small scale test of method and procedures assesses the feasibility, acceptability of approach to be used in larger studies. Here the answer is pilot study. So what we do before doing a big study, we do the study in a small level. In a small level like 10 to 15, groups I am doing the study to check the feasibility, like is it possible to do the study. When the pilot study passes, then I plan the big study, right? So for the feasibility, I do a study, pilot study. Which of the following is a non-parametric test comparative with one-way ANOVA? So here the answer is Kruskal-Wallis. Remember I told you Mann-Whitney and Kruskal-Wallis. If group 2, then Mann-Whitney. If more than 2, then Kruskal-Wallis. Now the feature of single exposure epidemic. Okay, so single exposure epidemic, what is happening? Suppose this is the hostel, the mess, the food was not good. Next morning, all the students, they developed diarrhea and vomiting, right? So exposure happened, and I will get the peak cases, and within 2 or 3 days or maybe 4 days, it will be all right. I will not get new cases, so no secondary case. This is true. It rise and fall rapidly. This is also true. The epidemic tends to be explosive. There is clustering of cases within a narrow interval of time. This is also true. Within a narrow interval of time, many will be affected. All cases develop within one incubation period. This is also true. But this is not true. The exposure to disease agent is prolonged. No, it is for a very short period of time. In fact, it is once. In single exposure, it happens only once. True about standard deviation. True about standard deviation. So standard deviation is root mean square. It is the root mean square. So the correct answer here is C, square root of mean of square deviation from arithmetic mean. Right? Now, which of the following will have highest level of evidence? We have already discussed. Meta-analysis have highest level of evidence. Which of the following refers to what extent the test accurately measures when it purports to measure? This is validity. This is validity. So what I am measuring, is that correct? This is validity. Whatever I am measuring, these two are same. Whatever I am measuring, is it repeating every time? So getting similar results every time is reliability, right? The yellow colored bag for waste disposal should be yellow bag of biomedical waste should be incinerated. Right? We should do incineration of yellow colored bag. In a study design, precision depends upon, yes, good question. In a study design, precision depends upon, okay, if I increase sample size, I will get more precision. If I get more precision, I will have more power of study. So these three are interlinked. Here the correct answer is, okay, where is sample size? Sample size. Alright. Which of the plastic container is used to dispose of face mask? Okay, so this question they have asked, I think they are asking you from COVID waste management, because under COVID waste management we throw mask of hospital or of the COVID patient or of healthcare worker in yellow, but in home isolation, the caregivers in home isolation, like this patient, this is COVID patient, and we have one family member who is taking care of this patient. So mask of the patient in yellow and mask of the caregiver, they should keep the mask in a paper bag, like in a paper, in a newspaper they may keep, or maybe a bag made up of paper for 72 hours, or you can say 3 days. For 3 days they need to keep their mask in that, and then after 3 days they must discard it as their municipal waste. They must throw in their dustbin, right? So here they have not mentioned anything, so I think the better answer here is yellow. Rural health scheme was launched in 1977. So this was on the base, the fact here for the rural health scheme, what they are using here is people's health in people's hand, right? Okay, so one more additional point I'm telling you here is this was suggested by Srivastava committee. In case they ask you who suggested this rural health scheme, this was suggested by Srivastava committee. So we are done with our PYQs related to INICET. If you have any doubt, I am waiting for your doubts in the chat box. Please write in the chat box. If you have any doubt, please write in the chat box. Thank you so much for your patience. Very quickly, we just covered all the PYQs related to PSM, which they ask in your INICET exam. If you have any doubt, please ask in the chat box. All right, so no more doubts. Thank you so much. I wish you all the very best, right? I wish you all the best. May God bless your hard work. Take care. If you have any doubt in PSM, feel free to ask me, right? Thank you so much.